away for Michigan schools, and we've been focusing on athletic injuries in our recent medical moments.
Many of them have been serious topics, but tonight Tim Doty looks at minor injuries like sprains, bumps, and bruises.
Whether it's a contact sport or not, athletes often end up sore when they're done with the game. If it happens to your child, there are some things to watch out for.
Is there swelling? Are they able to do things such as walk? Is the pain able to be controlled with some medication?
The first line of defense is a team doctor or trainer, but they have to keep an eye on a lot of team members. That's why Dr. Matt Axtman of Spectrum Health Medical Group says parents are key.
If they're coming home every day saying, my shoulder hurts, my shoulder hurts, my shoulder hurts over and over again, and nobody's doing anything about it, that's when you've got to pull the trigger and say, have you seen somebody? Have you talked to your coach?
Tylenol and ibuprofen are good, even for teens. Just follow dosing directions. Rest, ice, compression, and elevation still apply too, and many injuries are going to get better just with time.
But if this thing is lingering on and on, going 3, 4, 5 days, and this isn't getting better, that's when you've got to get in to get seen by somebody that knows what they're doing with that athlete from that sport perspective.
Sometimes that can give peace of mind about the injury. Other times, an athlete can gain some sport-specific knowledge so they know what to do and what not to do as they travel the road to recovery.
The thing that you do not want to do is you do not want to push them back into sport if they have an injury, because that's concerning that they might injure that further, or because they're compensating for that, might injure another part of their body.
Tim Doty, Fox 17 News.
Well, summer's over for most of us, but not one bear in Pennsylvania who's still